Good morning, Dr. Boris Nektalov from Nektalov Health and Wellness. So today I would like to go over what is spinal corrective care is all about when people come in and asking for spinal corrective care. When people come in to see us, either for neck pain or back pain, first thing we do is evaluation. What does this consist of? We're doing a consultation with a patient. We then examining their spine, we're checking their posture, and then we're taking x-rays to make sure everything is safe and to see if you're candidate for chiropractic. So we use this table here for an evaluation. I would go through the palpation of their spine to see where the pain is, if there's any type of muscle spasm or vertebral misalignments. So we do the posture exam as well, and then over here we come here and we do what's called digital spinal x-rays. So when we do spinal x-rays, we don't just concentrate where the pain is. We want to make sure that the whole spine is where it needs to be. We do 2 of our neck, 1 of mid-back, and 2 of lower back spine. Okay? After all this is taken, we prepare what's called report of findings. Usually that happens on the follow-up visit. When they come in, I prepare and I show them how their spine is aligned. In order to understand where the problem is, we need to understand what is normal. So let me show you over here. So when we're looking at the spine and the person, the alignment of the posture should be earlobe right above the shoulder, shoulder right above the hip, hip right above the knee, and the knee right above the ankle. Right from the front, our spine, our posture should be straight like this. So we shouldn't be standing like that or like this. Or some people have a shoulder higher than the other one. Then we look at the spine from the side especially. So we have to have 3 C-shaped curve. That's normal. Curve in our neck, upper back, and lower back. When we're looking at the x-ray, we have a curve here. If you can see, same thing as here. Upper back, curve, normal, and lower back curve. Okay? Why do we have these curves? It's to absorb gravitational pressure throughout our spine. When we lose these curves, it looks like this. If you can see, there's a disc space between each vertebra. It separates so the nerve can come out. When we lose the curve, these disc spaces start to diminish. Same thing in our lower back. There's a difference. Normal, abnormal. Normal, abnormal. If this is not corrected, it starts to degenerate. There is starts to begin what's called arthritis, spinal arthritis. And if you look at over here, somebody that has this, they are in excruciating pain. So if this is not corrected, that's what happens. Okay, and this is end stage. Okay, so once they come in and I explain to them what's their problem and they decide to go through the corrective care, I'm going to show you what's the process of the corrective care and what's involved. Follow me. Alright, so they begin, so as they're coming in, the corrective care is 30 visits. Every 10th visit we do a reevaluation. We'll show you in a little bit what is before and after looks like. They would sign in, they would come in, and they start with wobbling. What does that do is it warms up the spine, the joints, the disc, so that we can do everything else, especially the adjustment. They would spend about 5 minutes here wobbling side to side, front and front to back, to make sure everything is moving and not stiff. Then we come in here, in order to correct that curve, as I showed you, right? We lost that curvature. We do what's called wall traction for the neck. They spend about 5 minutes here as well. So that's what we're doing. Come back up. And up. What does that feel like? I literally feel traction in my neck. If you relax good enough, you feel it in the lower back as well. Okay, come with me. Then this is what we call an FND, flexion distraction. So patient would lie down. I would strap their legs like this, and the table goes it literally flexes and it stretches your spine. So let me show you. So they literally would lie like this, and they feel that stretch in their lower back mainly. Alright, so this is also a preparation for the adjustment and for the other exercises we're going to be doing. Okay, so thereafter, we're coming over here. This is what's called intersegmental traction. We want to make sure that every single joint in our body, in our spine, is mobilized and not stiff, so it makes a lot easier for the adjustment to happen. So if you come over here, you can see the rollers. And when I lie on the table, the rollers and the table is moving, and the roller is going through my spine. Literally, it feels like, a lot of people say it's a massage. So it's definitely enjoyable. A lot of people snore on it. It feels amazing. Thereafter, we come over here. This is a whole body vibration. Not all, but some gyms have it. It really challenges your balance. Okay, so what we're doing is we're putting a weight. So if most people that come in and they're doing this procedure because they have forward head posture, it literally looks like this. Okay, so we want to bring it this way. And why would it look like this? Let's talk about this a bit. It starts from a childhood. When you're carrying a bag, what is it doing? Especially if it's heavy, it's pulling you back. What are you gonna do naturally? You're gonna try to pull it forward, and you're walking like this, year after year, from first grade to the 12th. So and then at the end, your posture is like that. If you have a desk job, what are you doing? Forward head posture, right? Screen is in front of you. If you have a phone and you constantly, so eventually your posture is like this. So what we're doing is we're trying to reverse that. We're trying to trick the brain. Now we're putting, it's an 8-pound, it's pulling me down. I'm naturally gonna try to pull it up. What am I using? I'm using the back muscles. And what this machine does, it vibrates and it stimulates the muscles while I'm standing. I literally feel the twitching of the paraspinal muscles. Right after this, we would come back here. I would place the patient, we would adjust them. And adjustment, I'm sure you've seen many videos of ours that we try to mobilize and realign the spine from the neck, mid-back, and the lower back. The last but not least, we come in here. This is, some people say, a torture chair, but one of the most effective ways to correct the curvature of the neck. They will spend about 10 minutes here, and then they're finished. This whole process takes about an hour. That's how long it takes. So let me show you a before and after of some of our patients. So if you can see, this patient is a 7-year-old boy. So he came in with a straight neck, complaining of a neck pain. After we finish with care, remember, we're doing, every 10th visit we're doing an x-ray to see how we're doing. Are we making progress or not? 80% improved. And we never, ever promise 100%. There's no such thing. It's not realistic. But his neck improved. Let me show you another one. Same thing here. Straight neck. We took an x-ray. Normal should be aligned here. This is after. Also, same thing, 80% improved. So this patient, for example, he came in with not neck pain, but a numbness of 2 fingers. So what's the problem? What's the relationship between these 2 fingers and the neck? The nerve that comes out from the neck travels down the arm. So this person comes to me saying, I have this. I said, listen, we need to look at the cause. What's the cause? What's the origin? We took an x-ray. Listen, I said, this is where it's coming from. Okay, so we took an x-ray and I said we need corrective care. He gave it a try. We took an x-ray, improved, his symptoms went away. So that's what we do when it comes to corrective care. For more information, please visit our website. Follow us on Facebook, YouTube, Twitter, and Instagram. All the best.